It's time to get things rolling. It's clear we've got a good crowd. Folks are excited to be here. We are excited to have Dr. Kimberly. So welcome to Baby Steps into Acupuncture. Today is our second session of what is now going to
Hold
be.
on. Are you recording?
Yes, I am.
Okay, good.
Thanks for checking.
Sorry. Sorry, I'll let you start over. Go ahead.
Oh, no, no need to start over. Today is our second session of what is going to be, it looks like four sessions from four different practitioners. So we're super excited and blessed to have these wonderful experts that are going to present. And I have had the sneak peek privilege of previewing what Dr. Kimberly is going to share today, and it is some good stuff. So you are in the right place. Get comfortable, get ready. We are here to go. Dr. Kimberly is the proprietor and owner of Meridian Family Acupuncture, an extremely successful acupuncture practice. She's also been with Meridian Technology for how long?
16 years, I think.
Wow, 16 years doing our research, doing our education, being our liaison with other practitioners out there, and overall just making this whole company and everything we do that much better. So, purpose of today is we've noticed that there's a lot of people who are intimidated by electroacupuncture. It sounds too complicated, sounds too difficult, too time consuming, whatever. And we are here to blow up those false notions and help people get started in a way that is fast, easy, readily understood, and something that you can do in your clinic tomorrow. So, with that, welcome, Dr. Kimberly. We're excited to hear from you. Take it away.
All righty. Thank you so much. I am excited to be here and I'm excited to share this presentation because so much in the world has changed since I became an acupuncturist 17 years ago. Yes, we learned about electroacupuncture in school. And in school, you might turn on, you learned about it and it was this box and you put a needle in and you turned it up and maybe you were going to get shocked or you didn't learn a lot as you moved forward in practice. And that has all changed in the last 17 years. Electroacupuncture is readily known, readily used throughout the acupuncture world. It is taught by many practitioners. The physical therapists are using dry needling. There is clinical research. Yes, they're using dry needling, but they're also using electroacupuncture. There's tons of clinical research on electroacupuncture. And honestly, at this stage of the game, if you aren't comfortable with using electroacupuncture, today's the day. Today's the day to get started, and I'm going to share why. So,
And real quick, as you're getting started there, Dr. Kimberly, I want to let everybody know this is going to be interactive. We're going to take questions at the end. And so pop the questions into the Q&A window, everybody, and we will make sure that we get to all of them. So go ahead.
Okay, so I am going to share my screen.
And I will turn mine off to get out of the way.
All right, baby steps into electroacupuncture, the Dr. Kimberly way. You know, as we become practitioners, we all find our own unique ways of working in the world and in the world of healing medicine. And electroacupuncture, I mean, we started in the ear years ago with different devices. We started, I had a Pantheon. I have used the Ito boxes. And the newest, greatest development in electroacupuncture has been the EAM devices. And I have to admit, I was a little nervous to get started with the EAM devices only because I was comfortable in the other way that I was doing electroacupuncture. And then I have talked to so many practitioners along the way who have said, yeah, I'm not sure. I don't use much electroacupuncture because it makes me nervous. And so I'm here today to hold your hand, to help you step easily into this next realm and help you build your confidence. So with
Oh, and
that,
hey, Dr. Kimberly, a couple of times you mentioned EAM boxes. They're actually EAI now,
EAI,
because now it's the
correct.
Electroacupuncture Institute. And so I didn't want anybody confused about what you're talking about. So EAI is the point of select boxes, the Electroacupuncture Institute Special Edition.
Okay. So why are you here? That is the big question. And I think that you're here because you want to be a better healer. You want to be able to help your patients to get better. We live in a time of the world where the conditions that we treat are harder than ever before. And we're looking for resources. We're looking for what will help. And as the world of frequency in electroacupuncture has expanded, there are more opportunities and more possibilities. And so I think you're here because your heart wants to help patients. I think some of you are here because you're curious. You are looking in and you're wondering if electroacupuncture is right for you. And you're wondering if perhaps the Dr. Kimberly approach has a different feel to it than what you've learned before. And I'm glad that you're here. And then maybe you're here because you're hesitant. You want to be excited, but you're a little bit afraid. And I welcome you as well. We have solutions for all of them. So what I would like to tell you right now is I want to give you permission to believe that you can be really good with electroacupuncture and that you can make the changes in your patient's life. You are a licensed acupuncturist. You're already qualified. You are 100% qualified to do electroacupuncture. And I want to give you permission to recognize that you don't need to know everything in order to get started. You need to know enough for effective treatment. And as that happens, I promise you that you'll then expand and you'll grow and you'll want to reach the next level and you'll learn the next new thing and you'll learn the next new thing. But today we're going to talk about the easy part of starting and what you need to do next. So this is my friend Deb Davies. When her and I graduated from college 17 years ago. And when you graduate college as an acupuncturist, you're getting ready to take your exams, you're getting ready for your licensure, you know the safety and the efficacy of point location. You understand where the points are located on the spine. You know where the lungs are and which points to be cautious with. You were drilled this in school all the way through. You already have that knowledge. You have a knowledge of the anatomy and the physiology. You probably know some basics of electroacupuncture. You probably have a device, and your device came with a manual. And the guy who created the device, who likely isn't an acupuncturist, he's an engineer, has created a book with basic information in it. You also know the efficacy of the big player acupuncture points. I mean, let's talk about spleen 6, stomach 36, large intestine 4, gallbladder 34. These are points that are the big names and the big players in the field because they work, they're effective. And so it's okay to start with the big player points within this journey. You will just expedite the treatment process by understanding these points. Perhaps you've already studied deeper into musculoskeletal sports medicine. And so motor points, perhaps that was part of your journey. And you're understanding the neural structures, you're understanding the governing vessel and all of the nerves that come off of the spine and how they communicate with the limbs in the body. You're understanding the neural structures which talk to the organs. So when you have enough knowledge that you can begin to synthesize this and expand upon it. So let me introduce myself. I know Dr. Adrian introduced me previously, but I am Dr. Kimberly Thompson. I live in Meridian, Idaho. I own Meridian Family Acupuncture. I have been an acupuncturist for 17 years, and I began working for Meridian Technology right out of college. I was about a year into my practice and found this ad in the paper that said acupuncture research. They needed someone to do acupuncture research. And I remember sitting there wanting to raise my hand. Well, that's me. I could do acupuncture research. I'm fresh out of college. This is perfect for me. So I began working with Meridia Technology at that point and thought it was going to be a little side gig for a while to build my resume. But let me tell you, the reason I have been with Meridia Technology for 16 years is because I love who they are, what they stand for, the advancements that they are doing in the world. And if you've been around for 16 years and you've watched me and you've watched Meridia Technology, you know that the growth for Meridia and the products and the tools and the resources that they developed have been amazing. And one of them is an newer electroacupuncture device. And I'll be talking about that today. Part of my job of working with Meridia has been to collaborate and learn from some of the best acupuncturists in the world. I have the opportunity to collaborate with amazing science minded individuals. I call them my amazing science nerds. I am not a science nerd. You might think I am because I work in the field of acupuncture research and development, and I am an acupuncture nerd. I am a give me a Chinese medical dictionary and I will dig deep. I love the internal pathways of the acupuncture pathways. I love patient education. I love teaching and mentoring the AcuGraph students, and that is why I'm here, and modern science. So today's agenda, we're going to talk about why electroacupuncture. I'm going to give you a simple analogy that I hope will help you to understand the effectiveness of electroacupuncture, but it's also an analogy that I use when I'm talking to my patients. So hopefully it will help you, and maybe it will be a way that you can explain to your patients what you are doing. I'm going to teach you 3 easy treatments that I utilize in my clinic. And we talked about that transition to the EAI Point Select. Is it still Point Select, Adrian? Am I using the right term?
Yeah, you are.
Okay, so I'm going to go with Point Select. So your easy transition options to the Point Select, I'm going to teach you how I began thinking from one device to the next, and perhaps why sometimes I choose one device and sometimes I choose others. And then, because this is the Dr. Kimberly Way, I'm going to talk about how I'm using electroacupuncture to get green grafts faster. And I love utilizing AcuGraph to be able to show my patient where they're at in their journey. So AcuGraph is used as a diagnostic tool in my clinic. And then I'm able to regraph the patient further down through their treatment plan and show their progress along the way. And so I truly have noticed that we get green grafts faster and a lot more often since we began incorporating electroacupuncture into our program. So I will share some additional resources, and then at the end, we're going to do some Q&A. So why electroacupuncture? I don't know if you like to spend your Saturday in your pajamas looking up clinical research and scrolling through and reading all the data that's out there about acupuncture from a science perspective, but I love to do that. And I'm just going to do a quick scroll through of some clinical research that I found, and there's more and more that is evolving and developing as in this generation than ever before. So just think about this: electroacupuncture for insomnia and depression. They showed that after 8 weeks of treatment with electroacupuncture, that the insomnia and depression significantly changed. Painful diabetic peripheral neuropathy. So they're showing that electroacupuncture helps change the intensity of pain, quality of life, and even sleep quality for diabetic patients. Cancer pain management. It's effective and safe for managing pain. Long COVID. This isn't something that we were talking about 17 years ago, but it is the buzz of our field right now. And it's important that we grasp this on a big level. Your treatment with electroacupuncture has helped improve palpitations, dyspnea, cognitive impairment, anxiety, and depression. Long haulers brain fog. 48 patients were clinically cured. There were 57 patients in the study. 48 of them were clinically cured from brain fog. Electroacupuncture significantly improved memory, concentration, and attention, and restored healthy function of the brain, liver, kidneys, and spleen, thereby enhancing the patient's physical condition and quality of life. I know that you're all treating long haulers. We are all treating long haulers, and coming up with effective treatment strategies is key. And electroacupuncture is one of them. Bell's palsy. Perhaps you've treated Bell's palsy through the years. They're showing that those who receive standard care plus electroacupuncture have a higher rate of normal nerve function at the 12th week. This is big. This is important for you to recognize your potential. Knee osteoarthritis. I treat a lot of knee pain in my clinic, and the electroacupuncture treatment group showed more significant improvement in pain due to knee osteoarthritis than the control group. This is significant. Plantar fasciitis. I could go on, and I won't keep reading all of these, but 80% of patients had a significant pain reduction when adding electroacupuncture for plantar fasciitis. And then what about hot flashes, menopause? How many of you are treating menopausal women in your clinic? 10 sessions over 12 weeks, a significant reduction in hot flashes, frequency, intensity, as well as improvements in health-related quality of life. So I'll stop now because I could go on and on about this, but you get the picture. One second here. What I want to say before I move to the next slide is, of course, Chinese medicine has been around for 5,000 years. We know what works. We know that we can help patients. We know hot flashes. We know knee pain. We know neurological conditions. We know this, but when we are able to take the clinical studies and bring them to the forefront, it brings in a whole extra level of confidence for our patients. And so there you have it. So having said all that, let's do this. I believe that a missing piece for many acupuncturists is understanding electroacupuncture and how to utilize it. So I have going to talk about two different devices that I utilize in my clinic. The Edo is it's a device that I purchased on Lhasa, and the Poino Select is the newer, greater, better version. And I'll explain why that is. I'm not just saying that because Meridia Technology sells the device. Hopefully at the end, you'll see the differences of how these are utilized. The Edo is a lower output intensity output device, whereas the Poino Select is higher output. And if I didn't get really clear in the beginning of this presentation, I am not the science nerd. I am not. But I choose resources that are clinically effective, and I am an acugraph nerd, and I am an acupuncture pathway nerd, and these devices fit perfectly into my strategies for treatment. So let me give you a simple analogy. Ha! I wish I could hear you laugh right now. The 3-year-old analogy. So patients ask me why I use electroacupuncture, and this is my grandson, by the way. If I was taking my grandson and I were going to tell him, you need to go clean your room. And if I told him to go to his room and clean his room, he would stop along the way and he would pick up, I'm not even sure what he picked up there. It looks like a piece of fried chicken crumb or a cornflake, but he would get lost and meander along the way. I feel like when you are putting electroacupuncture on the needles, you are telling the needles what you want them to do. You are telling the energy within that pathway where you want it to go. It is like holding the hand of a 3-year-old and helping them to get the job done instead of expecting them to do it on their own. So it helps me, excuse me, I need a drink of water. It helps me guide the energy where I want it to go. So, and then if you're a kid and you've got the secret language, which I think my grandchildren do, they talk in this little talk with one another and they understand each other that I don't understand. Well, that is what the frequencies, that's how the frequencies are related in the acupuncture pathways. When you add the right frequency and the frequency to the needle, you are telling the energy what you want it to do and how you want it to do it, so that as the energy is moving through the channel, it's moving with purpose and it is helping your treatment to become more effective. So I feel like these secret codes that we put into the acupuncture needles are kind of like the AI of frequencies, and your body knows what frequency it needs. It's a matter of you as the practitioner having a bit of knowledge so that you can get the right frequencies into the body. So if we look at the frequencies, I've got 2 different lists of frequencies. This, the list on the left is information that I got from Dr. Jeremy Steiner. And the original devices ran at 10 hertz, 15 hertz, 40, 80, 150, 200. They were very whole numbers. And that's because the ability to set them was not digital. It was by turning a wheel. And so you could get the right frequencies. And so the list on your left is the list that goes to the Ito box, and the list on the right is the list that goes to the point of select box. So let me tell you this. I had a great conversation with Dr. Steiner the other night, and I'm like, okay, I want to be sure that I am offering the right frequencies and the right information to the people who are attending this webinar. And do you have any feedback for me? And so we were talking about, let's take 80. 80 on the list on the left says GABA. And then he said the frequency that's closest to it on the right matches the same zone. So 80 and 73 are kind of the same. 36.5 and 40 are kind of the same. 18.3, and if you had 20, I don't have 20 on the other list, but it gives you an idea of the frequencies related. Then we got talking and I said, but Dr. Jeremy, you've got GABA at 80 hertz, and then at 73 hertz, we've got spasms, headaches, depression, bone fractures. And I'm going to teach you something that I learned from Dr. Jeremy that I think is pretty exciting. So if you were to look up GABA, what happens in the body when GABA is created, because it's a hormone, when you add more GABA into the body, what changes do you get? So when you're looking at the list on the left, look up dynorphin, look up the serotonin, look up dopamine, and get the physical changes that happen, and it might give you a better list. So this is a big list, and this list is not simple. I will admit that it is not simple. I'm going to teach you something that I think will make it simple. So there's this concept of harmonic frequencies, And harmonic frequencies, I'm going to get rid of that. Harmonic frequencies are when you have two frequencies that you combine together, and it creates this beautiful blend together. Think of it as one note all by itself just is a note. But when you take two notes and you play it together and the harmony comes about, it turns into a whole different layer of notes and music that is beautiful to listen to. Well, the same thing goes with frequencies. If you have two frequencies and you're playing them together, the gentle vibrations that when those frequencies combine together will change within your body, and it will blanket the area and the acupuncture pathways and your entire body with a whole slew of frequencies. Then the beautiful part is your body knows what it needs. Your body knows what to do. It will pick up the frequencies that it needs. So then the big question is, which frequencies should you use? So I have highlighted them for you. If you are using an Edo box or a low frequency device, I recommend doing somewhere between 1 and 5 hertz on as one frequency and 150 on the other. The two frequencies that I use on my Point O Select devices are 4.6 and 73. I treat a lot of nerve issues, chronic pain, circulation. This is a good baseline to get started. And recognize that this is a starting point. You can always expand your knowledge as you move forward. But if you just need a place to start, choose 2 sets of frequencies. Now, what that means is, let's see, my next slide will say it. So you need, if you're going to use the Edo, here are the frequencies. And if you're going to use the Plano Select, here are 2 frequencies that will get you started. Please recognize that you need 2 of your desired device. So if I was using the Edo, I would need 2 Edos. One Edo would be set at 1 hertz and one Edo would be set at 150. If I was using the Point O Select devices, I would have one set at 4.6 and one set at 73. So recognize that 2 devices. I think taking a picture of this screen is valuable because this is the simplest version to remember which frequencies that you need to use. So I'll give you 3 more seconds if you're going to take a picture. 1, 2, 3. Also, the slides are going to be in the handout. Okay, now that you have your devices and you've chosen which frequencies you're going to use, I'm going to teach you 3 very easy treatments that you could pick up your device tomorrow in your clinic, and you could do these treatments easily. So we're going to talk about root treatment, branch treatment, and spinal brackets. So I am very much a big proponent of root treatment. To me, the condition of the acupuncture pathways, that is the root. The extra symptom that you have coming in, that is the branch. And with spinal brackets, you can treat root and branch, and we will get further into that. So let's talk about the root. Now I feel like I'm going to be talking to my patients. Every acupuncture pathway that runs through the body, it runs superficially. There's also a muscle region attached to it. Every one of those acupuncture pathways, while you're treating the pathway, that is your side road introduction into the internal organs of the body. I love understanding all of that together, and every one of those acupuncture pathways has an emotion. So what are you going to do? You are going to fill up the pathways with the energy that comes from your device. My favorite phrase that I've learned from Dr. Jeremy is benevolent chi. I thought that was a genius a genius way to talk about what we're doing with acupuncture. When you're filling up the pathways, you're filling the body with benevolent chi so that the body can heal. You can do that with source points. You can do that with evidence-based points, like let's go to the big players, right? Spleen 6, stomach 36, liver 3. You can do that based on internal pathways. I feel like internal pathways, when you're treating the source point, you're going directly to the internal organs. You can do that with muscular pathways. And if you understand the bundling at the muscular pathways and you're treating that pathway with electrical energy, you get major changes. And I'll show more of that in a bit. You can even treat the tonification. You can tonify or sedate the body, and you could choose tonification or sedation points. So I would like to stop my presentation for a moment and just peek inside Acugraph, and I'm going to give you an idea of when you're looking in Acugraph, how you could begin thinking about filling up these pathways. And then I'll come back and teach you how I do it. So let's see, we're going to bring up Acugraph. There we go. So here is a long hauler syndrome patient. When I am talking to a patient, I can show them the pathways, but right now I'm talking to you and I want you to recognize, go beyond just I'm treating points and what point should I treat and how do I get rid of scar tissue? Think of the environment. Dr. Jeremy talks about changing the internal environment in the body, and that is with changing the acupuncture pathways. So if I were going to just show you, let's go to the lung. I'm going to show you the internal pathway. When you are treating the lung pathway, this is where the energy goes. So whatever point that you're choosing on the pathway, imagine that you're filling it with benevolent chi all the way deep into the organs. I'm going to scroll through. Right now, I have my view up. I'm going to go with energy cycle. Here is the lung. And this is the cycle of the pathways all the way through, and it goes all the way to liver, and then it goes back again to lung. So when you're looking at these pathways and you're thinking internal, where's this energy going? Where is this benevolent chi going? What am I affecting deep inside the body? This is the internal pathway of the lung, the large intestine. When you are treating that large intestine pathway, it goes through the lung, through the intestines, and even down to the knee. How long has it been since you've looked at internal pathways and considered that you are affecting the knees with that pathway? The stomach pathway, look at the face and Bell's palsy and look how it affects the stomach. Look at these branches that come all the way down to the feet. Right at about stomach 36, there's branches that go to the toes. Have you ever considered internal pathways when somebody has foot pain, when they have plantar fasciitis, when they have neuropathy, especially diabetic neuropathy? That's why stomach 36 is such a classic point for that condition. The internal pathways make sense. So if I was filling stomach 36 with benevolent chi, look where it's going to go. See how it's going to come all the way down to the toes? The spleen pathway, when you're filling that spleen pathway up, you're affecting the sex organs and the hormones and the blood production and the stomach and the heart and right through the thyroid and the heart pathway. So I won't talk about all of them right now, but I'm going to just go through. This is the small intestine pathway. Oh, I can't not talk about this one. If you look at small intestine pathway muscularly, here's the muscle pathway, and all of your patients come in with this shoulder pain and neck pain. But if I am going to fill that pathway with chi, I'm going to change the ears and the eyes and the heart and the stomach and the intestines and the knees. It's beautiful. Internal pathways are amazing. The bladder pathway, you're affecting the kidney, the bladder, the brain. I love the kidney pathway. Oh, kidney. The kidney pathway, when you are filling up that pathway, you are affecting knees and groin and spine. When you go deeper into that pathway, you're affecting the lumbar spine and the kidney and the bladder and the lung and the throat. So begin thinking of filling up the pathways. When you are treating those points, you are making a significant difference inside the body. Pericardium, triple energizer, gallbladder, and liver. So, having said that, I'm going to go back to my presentation. Here we go. And we're going to go back to play. And now we'll talk about this root branch. So, if you were using an Ito box, you would choose two pathways and you would put 2 needles per pathway, and you would do one lead at 1 hertz and one lead at 150. So here's an example. Here's a classic needle combination, liver 3 and Li4. So if you did liver 3 and Li4 at 1 hertz, and you're talking to the body like this, and you did liver 3 and Li4 at 150 hertz, you're using 2 boxes in order to get your 2 sets of frequencies, and you're running 1 and 150, and then you're creating the harmonics within that pathway, or within those 2 pathways where they're connecting in between. Oh, I can't not go back to acugraph. So look at what that looks like. So if I am treating large intestine pathway internally, here's the pathway. I am affecting this muscle region, and I am affecting the mouth, the lungs, the intestines, and the knees. And what was I treating it at? I think I was treating it at 1 hertz. Then if I'm also treating the liver and I'm treating liver 3, here's the external part of the pathway. Muscularly, I'm treating the groin. Internally, I am treating the sex organs. I'm treating prostate. I'm treating reproduction. I'm treating female health. I'm treating the liver, the gallbladder, the digestion, the detox pathways. I'm treating the lungs and the throat and the eyes and the top of the head and the emotions that go with it. So, I mean, it's a beautiful combination, but when you think of that resonance energy that's happening in the center, imagine the internal pathways. Imagine that you are filling these pathways with energy and you're making incredible changes in the body. So I'm going to go back to my presentation. So that is the root. That is a root treatment. I'm just giving you an idea. That's an A root treatment with the Ito. If you're using the Point O Select, I want you to see what's changed. We'll go back. Okay, so this was 2 wires, liver 3 to Li4 and liver 3 to Li4, and I'm using 2 sets of frequencies. As I'm moving to this box, all of a sudden I have 2 devices, and I am choosing 4 pathways. So I'm choosing 4 pathways that I want to fill with benevolent chi, and I'm putting a needle. So in this example, I'm using large intestine 4. You like my graphics here. Large intestine 4 is the blue one. So I'm doing large intestine 4 at 4.6 and liver 3 at 4.6. I am filling those 2 pathways, which are combining and creating the resonance effect of what I did in the previous one. But now I've added stomach 36 and a large intestine 11. And now I have 4 pathways that are filling with benevolent chi, and internally everything is combining and we're getting this beautiful resonance effect. Let's talk about branch treatments now. So a branch treatment is different than just filling up the pathways. Now we're taking a problem and we're trying to change the dynamics of the tissues where that problem is. So I will I think of this like dredging the channels, like somebody has chi and blood stagnation on their on their quads, on the front of their leg, and it's everything is stuck, and I need to dredge through that. And a perfect example of that, that's the stomach muscular pathway in this picture. Ashi points, chronic pain, tendinomuscular treatments, inflammation, stagnation. This is the approach that you would use for scar tissue and adhesions. And I like to think of it like if I were doing cupping and I was trying to resolve stagnation in an area, this same approach works well, but now you're using electricity. So let's move forward. So now we have a branch treatment with the Ito device. I like to choose 8 points, and if I choose 8 points, they're usually ashi, so I'm not telling you what names they are. And I am putting them wherever it is. You could do a surround the dragon, you could whatever approach that you want to do, but I like to use 8 points. I use 2 leads at 1 hertz, and I use 2 leads at 150 hertz. Again, I'm using 2 boxes. I'm getting the harmonic response, the harmonic frequency response, because I'm using 2 sets of frequencies. The body is going to pick up in that area everything that it needs to create the healing response. Now, if I were going to use a more advanced device like the Ito, here's what I would do. I could choose as many ashi points as I want. In this diagram, I chose 6. And I used my 2 Ito boxes, and I'm taking one one set of leads that are running at 4.6, and then I'm using another set of leads that are running at 73. And less needles, double the action, more effective, more powerful. So that is my branch treatment philosophy for the Ito, or for the point of select. All right, you guys, now we're going to talk about spinal bracketing. You probably learned something about spinal bracketing when you were in college. If you go and research online about spinal bracketing, you will find so much information. Huato Jaji, spinal segmenting. I've seen it called neuropuncture. I have seen it electron adapted neurotherapy, neuromuscular dermatome treatment, spine cord electrostimulation. And when you're looking at clinical studies, they're doing a whole lot with clinical studies in relation to the spine. I was talking to a friend of mine this morning, Dr. Crystal Couture. She is a pelvic floor specialist, and she was a physical therapist before she was an acupuncturist. So she has a unique perspective. And I asked her what they were calling this in the physical therapy world, because I just came from a weekend with her, and we definitely did this type of treatment in relation to the pelvic floor. And she had a lot of information to share. She said, from a biomedical perspective, it's called segmental needling, which is treating the associated spinal segment with the tissue or the pathology. And then there are more advanced versions of it that she shared. But as you can see, it's well documented, it's well known. The dry needling world is using it, the PT world is using it. The Western doctors are who do acupuncture are taking this philosophy and in how they're doing injections into this, cortico injections into the spine. I think it's really important for you to understand it and grasp it. And I'm going to teach you how simple it can be to get started. You can expand and expand and expand. There are amazing instructors out there who, Dr. Steiner, I mean, he's all over this, and I highly recommend that you learn. So here we go. Notice that I have a graphic here. Here we go. So what you want to do is you want to recognize where the area of pain is on the body. And then when, let's just say the person has knee pain, you can look at knee pain in this picture and you can see how L4 is going to be affected, L5 is going to be affected, and the back of the knee, there's L4, L5, S1. So S1 and S2. So the sacrum, which are actually back shoe points for the urinary bladder panel, SI and UB, it gives you an idea of where to go. So match up, once you find the area of the pain in the body, match up the correct vertebrae, and then you're going to treat the Huato Jiaji points, AKA dermatomal segments. I mean, this is where it branches off. It's such an effective treatment that the Western world, the physical therapy world, the chiropractic world, this is well known, and you can go and do more research. I'm just teaching you the basics on how to get started. So it is a root and a branch treatment, because when you are doing this treatment, you're regulating the organs, you're also regulating pain, and you're reconnecting the electrical signals from the limbs to the brain. So it's a highly effective treatment. Let's move on. Let's see. Whoops. Spine cord. Okay. Am I going the wrong way? I am going the wrong way. So I borrowed this graphic from Dr. Steiner. What you need to recognize is that when you're treating the Huato Jiaji points, they're a half soon away from the center of the spine. And Dr. Jeremy teaches that if you put your thumb on the center of the spine and then you needle on either side of your thumb, you're in a safe zone. You're actually, when you're doing this needling, you're actually going to touch the bone with the needle. You don't want to do perpendicular needling beyond the half soon from the spine, because that's where you can puncture lungs and organs. So I would recommend, for safety, know your anatomy, brush up on Huato Jiaji, needle perpendicular, put your thumb on the spine, and that's what I have to share with that for now. Let me move on. So here's my picture again. So spinal bracketing. In this example that I'm giving, the red X shows the pain. Let's go back for a second. And if you had pain where that red X is, which would be right here in the green zone, somewhere around C6, right? That's what you would find on your chart. So this is C6 where the arrow is, and this is your pain zone. In order to treat the pain in the shoulder, you're going to use 2 sets of wires, and you're going to use 2 leads at 150 hertz and 2 leads at 1 hertz. And that's how you're going to get the resonance blanketing effect. I like to do, notice I have the 150 hertz on the outside of the problem, and I have the 1 hertz in the middle. I feel like the 150 is pushing its way in strong, and then the 1 hertz is it's less strong, but it's creating that a different vibrational healing. Everything comes together. Dr. Jeremy will teach you that you should be, when you're treating, you should be two vertebrae below where the problem is, because spinal energy moves upward. So I'm going to talk from the other approach in a second, but notice that I'm not even needling exactly at the C5, C6. I'm just getting the needles in this area. I'm surrounding the problem, and this treatment will resolve the pain in the shoulder. Next slide. So spinal bracketing with the Point-O Select is a game changer. So you only need one needle one needle with a disclaimer. You need one needle on the do channel, couple of vertebrae below the spinal bracket dermatome that you need. So here, we'll review this again. Here's your pain. It was the C5, C6 dermatome. So we're going to C5, C6 on the spine. I'm going a couple vertebrae below it, and I'm putting a needle in, and I'm hooking up one lead to the needle, and then you still have to hook up the other side of the lead to something on the body. You could do, and this is GV14. GV14, I love why would I choose GV14? One, it's a couple vertebrae below where the problem is, but GV14, it's a crossing point for all the acupuncture pathways that go through the head. So it's beautiful. Not only am I affecting the spine in that I'm pushing energy up through the spine, through the shoulder pain area, in the spinal bracket, but I'm also affecting GV14, which is huge and big and releases all the energy in the head. If I've given kidney 7 or kidney 3, if you hook up the second one to kidney 7 or kidney 3, you are affecting the muscle, think of the muscle region of the spine. Well, let me just show you. Let's see. Go back to Acugraph for a second. Let's go to kidney. So here's the kidney channel. Choose kidney 3. But muscularly, look at what you're doing. You're affecting all of the small musculature all the way up the spine. So not only do you have a needle up at GV14 to catch the dermatome, but you have a needle down at kidney 3, which is pushing energy all the way up the spine as well. So hope that's helpful. Let's see, have I covered everything that I need to in this slide? Yes, let's move on. Okay, so I now have 2 quick bonus tricks that I want to share with you that are related to my experience within Acugraph. And I have gotten really good at getting green grafts faster. And I believe that pumping the body full of benevolent chi is one of the elements that has made this progress so incredible. So I would like to share what I am doing in my clinic. So I'm going to share first in the slides, and then we're going to go and peek into Acugraph one more time, and I'll give you the behind the scenes look. So in Acugraph, there is a picture of the spine that comes up regularly, and I'll show you where that is when we go in Acugraph. If you have a really messy graph, the spine will have a lot of red based on the analysis. The actual picture in Acugraph will say T10, and then it will list all the pathways that are related to it. And if they're all out of balance, then those particular areas of the spine are going to become more red. So one of the tricks for a very messy graph is I like to treat GV14 because GV14 is one of my favorite points anyway. And I like to treat GV2, or you could treat GV3 at the lumbosacral area. GV2 I really like. So think about this. I'm using 150 hertz. I didn't show you which box I'm using here. For this particular treatment, I'm using an Ito box. So I'm running 150 hertz between those 2 needles. So what's happening? One one needle is sending a message down and one needle is sending a message up. The resonance therapies are happening in the middle and it's cleaning up the spine. What a beautiful treatment. You can affect the entire body by cleaning up the spine. And this is one of my approaches. So then another approach that I have is I call it global balance. This is how I write it in my notes, global balance, full body. So if you have a really messy graph, and here's an example, look at where do you begin? You got a lot of red, you got a lot of blue. Patient has a lot of health concerns, health issues. If you have a really messy graph, you can take off many layers of that problem by using my 4 favorite points. And you'll understand why. Spleen 6, stomach 36. I mean, those are classic. I spent some time recently needing to do some clinical research for clinical studies. And as I'm looking up study after study after study after study, they're using spleen 6, stomach 36 over and over and over again within, especially for leg neurological conditions in the feet and the legs. And when you look inside Acugraph, it makes sense why stomach 36 is so effective. We'll get back to that in a second. So if I'm treating spleen 6 and stomach 36 at 150 hertz, and I'm treating liver 3 and LI10, you might wonder why I'm not treating LI4. I'll show you within Acugraph why I love LI10. I know that there's a lot of clinical research that LI4 is so effective, but I love LI10 for this purpose. So 4.6, I'm getting the beautiful resonance response. I am getting an effective treatment, and I'm taking off a lot of layers of what's going on. If you look at these points and you look internally, look where the energy's going inside the body. Look at spleen 6. Then look at liver 3, look at large intestine 10, look at stomach 36. We are affecting the heart and the stomach and the lungs and the sex organs and the detox organs and the elimination organs. We are affecting the feet. Then it gets better. Let's look at the muscle pathways to each of these. The muscle pathways, the liver pathway and the stomach pathway, you're treating pain in the legs. Stomach pathway, you're getting the feet and the legs and the hips and the mid-back. You're getting the sinuses. Look at the large intestine pathway. You're affecting shoulders and thoracic spine and band around the head, headaches. Spleen pathway, this is the only picture within Acugraph that I feel like it doesn't truly do the spleen pathway justice. The spleen oversees all of the muscles in the body. So when you have an imbalance in the spleen pathway, you can have aches and pains all over. And it's a classic for fibromyalgia. So just think of all the muscles in the body that you're affecting when you're treating the spleen. So if I was doing global balance, full body, if I was doing the Edo boxes, this is what my treatment would look like. But if I was doing the Point-O Select with the EAI boxes, this is hugely dynamic. You have 4 points that you're filling the body with benevolent chi, and you are making an impact through all of this and all of this with just 4 points. So I guess the difference, a major difference would be if I was using the Edo boxes, I would be doing liver 3 and liver 3. And I'd be doing large intestine and large intestine. I'd be doing spleen 6 and spleen 6. On the other hand, if I'm using the more advanced boxes, I'm choosing a liver 3. On one side, I'm doing a large intestine 10. On the other, I'm doing a spleen 6 on a stomach 36, one leg versus the other. And that part is done. And again, I'll go back to my messy graph. Layers happen. You're able to remove layers with this treatment because of the internal pathways and because of the muscular pathways. Okay, I think I'm peeking into Acugraph one more time. With this treatment approach, these are the types of changes you can see. So here's a very messy graph, lots of problems. The newer graph shows all the layers that have come off, and now we're down to we can get deeper into the problem. By the time I reach this point, now I can, instead of using my global treatment, I can choose very specifically. Maybe on this treatment, I'm treating the lung, and I'm treating bladder 60, and I'm treating spleen 9. And if I was doing spleen, I'd like to do stomach as well, because most problems in the body are related to the earth pathway. So spleen and stomach gets you really far. So if I was just using the newer device, I could literally begin fine-tuning my treatment and getting very specific. Within Acugraph, if I click on the spleen and I'm showing you the pathway, it also gives me recommendations. Do I want to treat spleen 2? Do I want to treat spleen 5? The tonification, the sedation, the luo, the she cleft. Certain pathways, I love to use tonification and sedation. Other pathways, not so much, because I don't know, like an example, the heart pathway. The tonification point is heart 9. I'm not comfortable with needling heart 9, but I love treating the source point, heart 7. And so this type of strategy, pick your points according to what makes sense. Pick your points according to what you feel on the body. I mean, a lot of what I do is based on the resistance that I'm feeling in the acupuncture pathways. But you literally can get amazing results by filling the body with benevolent chi. Oh, I know what I needed to show you in here. Spinal. Let's go back to the messy graph. So here's a messy graph. And then this right across the top, we go points, herbs, food, custom, and spinal. So here's the spinal segments related to this graph. And what this is telling us is, if you see bright red, it means there are more problems or more acupuncture pathways that are affecting that spinal element than other pathways. So some of these vertebrae are not L3. L3 only has one imbalance related to it. But look at T8, gallbladder, kidney, liver, pericardium, spleen, stomach. Well, sure, I could treat the GV below T8, but because this graph is so messy, if I come down to GV2 and I'm sending energy all the way up, and then I am treating GV14 and I'm sending energy all the way down, you're getting a beautiful treatment. That in itself, and you add spleen 6 and stomach 36. So let's say you're doing 150 hertz here, or you're doing 73 hertz here, depending on the device that you're using. And then you're adding a spleen 6 and a stomach 36 with 1 hertz or the 4.6, you're going to get an amazing treatment. And it's going to help you get to the point where you can figure out what's next. Get down to the nitty gritty. You're taking off layers. All righty. I am looking for, there we go. All right, so we've peeked inside Acugraph. I have showed you multiple avenues on how I get green grafts faster. These are real patients. This is a real anomaly. I share often with my Acugraph users pictures like this, and people are like, yeah, Dr. Kimberly gets green grafts, but we don't. I want you to know that you can. And the way that you will do that is with benevolent chi. So your next steps after this webinar are you need to trust your equipment. Choose something. Choose one set of equipment that you're using. And then there are simple starting points. A root, fill the body with benevolent chi. A branch, use our chi points and fill that area of tissue in the body that needs to heal, fill it up. Use spinal bracketing and know that the spinal bracketing, you're treating the spine in relation to the dermatomes. Go online, get yourself a dermatome chart, print it out, stick it in your treatment rooms. I've taught you my Acugraph global balance of the spine, and I have taught you how I think about balancing the full body with electroacupuncture. And what I've taught you is just how to think. You will expand and you will grow and it will get so creative. And you'll walk out of a treatment room and you'll walk out of a treatment room and you'll be like, wow, that was creative. Look what's happening, because you understand the internal pathways. You understand where the energy's going. You understand how those resonance frequencies are blanketing the body, and it becomes fun. No two treatments are exactly alike. I mean, I'm giving you general ideas, but oh, wait, I have to show you one more thing. Going back to Acugraph. Hold on. Why I like large intestine 10. So if the patient is on my table and they have anything, headache, neck pain, shoulder pain, everybody has shoulder tension. Large intestine 10, if you look at the musculoskeletal pathways, this black spot right here is right about large intestine 10. When I am treating large intestine 10 and I am putting a needle on one side and the other, the communication is coming through my head all the way to the other side. And that communication is going back and forth and back and forth and back and forth. So I feel like that is a very effective treatment for relaxing shoulder tension. This isn't the small intestine pathway where most people have their problem, but look, if you look at the muscular pathway right here, how it overlaps the scapula, it goes to the thoracic spine. The thoracic spine is going to feed into the muscular pathway. That is why I love it. So internally, of course, we're affecting the lung, the intestines, and the knees, but muscularly, I love this bundle right here at large intestine 10, and I find it to be a very effective treatment. Here's the example. Here's the small intestine muscular pathway, and then here's the large intestine muscular pathway. I feel like I get a double approach that is really effective. All right, I've been ignoring questions. I know that you have them, and I am excited to share them. A few additional resources for you. If you want to then go deeper, I've taught you some basics on how to get started. Dr. Jeremy Steiner wears the big shoes. He is an absolute genius, so intelligent when it comes to electroacupuncture. Most acupuncturists in the field, if they're doing electroacupuncture in this generation, they've learned from Dr. Steiner. He's on top of it. He's advancing the field in many ways. He is teaching about neuropathy and spinal issues and nervous system and thyroid. You can expand into all of those areas if you get started and you begin with the easy stuff first. And now we're going to go to Q&A. And I'm back.
Hey, great job, Dr. Kimberly. Thanks so much. We've got a whole crop of questions. Just a reminder, everybody, we're going to be looking in the Q&A, so hit the Q&A button to ask your questions. And so do you see those, Dr. Kimberly? Do you need me to read them to you?
Let's see. Vaughn, I'm nervous to use the machine on the neck because instructions for my machines warned to not use it by the neck. I get it. That is exactly why many of us were nervous back in time, but it has been proven over and over and over again in clinical science, clinical research. Dr. Jeremy Steiner treats the neck all of the time. It's effective and it works. And I get it. I was nervous too, but trust the journey of what's happening. All right, let's see. Anonymous, can you use one Ito and one Point Select if you don't have two of each? I'm going to think about this for a second. I don't see why you couldn't. You will still have two sets of frequencies. You will have harmonic frequencies. The bonus to you is that with your Point Select, you can treat two pathways. You can fill up two pathways. So you have to segment your thinking on what you're doing, but yeah, you can.
Never been asked that one before. That's a good
Yeah.
one.
So next, if I only have one EAI and one Ito, can I combine both? I just answered that. All right, Frederick says, what is the possible EAI point of select approach for paralyzed patient with one above knee amputation? That's more of an advanced question. There are lots of strategies. You can use your spinal segmenting. I even think that if you have, what's the term, Adrian? Ghost pain, like
Phantom limb pain.
phantom limb pain. I would totally use the spinal bracketing for that treatment. So that question's probably beyond the scope of this webinar. That's more of a, you're in a specialty training program. Sorry. All right, Frederick says, Dr. Jeremy says that he used to be terribly frustrated. Impatience came in with the chief complaint of constipation, but now he loves to treat this condition because it in 20 minutes has success. So I just shared that approach. Think about it. You are treating with what I've taught you for a global treatment. You are treating the spleen and the stomach. Stomach energy is coming down, spleen energy is coming up. You're treating the large intestine pathway. So the large intestine pathway that's coming down the body to promote diastasis. You're promoting diastasis in the stomach, you're promoting elimination. Oh, and liver is going to help with elimination as well. So I would try first with the global treatment. If Jeremy Steiner has a very specific different approach, that's amazing too. There are many ways that you can do electroacupuncture. Someone has pain in the right lateral elbow. Seems like it would be good to needle the thalamus. Yes, it sounds like you've been studying with Dr. Jeremy in relation to which points to treat, and you're on the right track. Again, this program is about people who are just wanting to get started. They don't know which device to use, and they're looking to get effective treatment, and especially that they want to be able to look at electroacupuncture through the eyes of acugraph and the acupuncture pathways. Let's see. What frequencies and for how long? Insomnia, depression, diabetic neuropathy. I keep my treatments at 20 minutes. That is what they have found to be effective with electroacupuncture. Everything that you're going to do is more effective. I don't have exact treatment strategies for each of these conditions, but remember, there's root and there's branch. So you are always going to want to treat a root. You're always going to want to treat the acupuncture pathways. And if you've been following me for any amount of time, I am a strong proprietor in the statement of, if you can get the acupuncture pathways in balance, 80% of the patient's symptoms can fall off the plate. And having the acupuncture pathways in balance does not mean that the patient is not still, you don't still have healing to do. It means that the body is in healing mode. You've changed the environment within the body. The terrain, Dr. Jeremy would call it, you changed the terrain, and you can do that with electroacupuncture. Can I do this spinal bracketing treatment while using other needles on other body points at the same time? Yes, yes, yes. Yes, you can. What about someone with fibromyalgia? Fibromyalgia it's again, my philosophy is balance the acupuncture pathways, and then once you've balanced your pathways, then you can expand into advanced treating philosophies. And fibromyalgia is an autoimmune disorder that has multiple layers to consider, such as emotions and physical pain and trauma that's stuck in the tissues. Daryl, I could listen to Dr. Kimberly teach all day long. My question is, 5 more hours. Oh, Daryl, you're a doll. I love you. Okay, Angie, herniated disc at L5. Is this okay for electro? Are there any contraindications we should be aware of? I treat herniated discs all the time. If you are going to below where two discs below where the problem is, and you're using the point of select, one needle at the GV, and you're filling the pathway upward, it will help to resolve inflammation. Oftentimes, a herniated disc, if you can just imagine the herniation coming through the discs, if you can get the inflammation down, the herniation comes back within, and that's when the healing happens. So electroacupuncture is a fantastic avenue to help get you there. With this style of treatment, can you run 150 hertz for over 10 minutes when combining with 1 hertz? I always only ran 150. You know what? I have heard lots of different philosophies of go into the treatment room and change the frequency after 10 minutes. And those are, I'm sure that those are very valid philosophies. That's not what I do. I turn it on, I run it for 20 minutes, and I'm done. So I believe that Dr. Steiner has taught this in the past. That may be an avenue to dig further. Let's see. Do you always cross the leads, or you do treat ipsilaterally as well? You know, I change it up sometimes, but if I am trying, I treat both sides of the body. I have no problem crossing leads. I have no problem going from arm on left to leg on right. I also have no problem treating large intestine 10 on both sides. If I'm doing that, what's happening is I'm getting this effect that's coming across and cross and cross and cross. But if I'm treating large intestine 10 on my arm and I'm treating stomach 36 on my leg, all of the interaction is happening in the middle. I still believe everything happens in the middle anyway at some point, because that is how energy moves. But you have different approaches to consider. How does electroacupuncture compare in effectiveness to biopuncture, which is becoming more popular? What is biopuncture? I don't know what biopuncture is, but I bet it's a form of electroacupuncture. Adrian, will you peek and see what that is?
Yeah, biopuncture involves injections into acupuncture points, either injecting saline solution or sometimes other substances.
So that's a scope that depends on where you live and if you're allowed to do that. But I'm not sure that they're injecting and adding electricity at the same time. But you can treat the entire spine. There's so many ways that you could do this, but I don't think biopuncture is the same. Electroacupuncture stands on its own and different. Can I do these treatments without using needles, just choosing 2 point select addition models? Adrian, can you add pads?
Yeah, of course. You can do
skin?
pads, you can do probes. So yeah, there are a variety of ways to do this non-needle. And absolutely, that's always an option.
So I've worked with companies that are electroacupuncture, and there'll be two probes, and you can touch the different areas, and you're connecting the energy, which is electroacupressure. It's not puncture. There's no puncture involved, but again, it's using electricity to connect the circuits within the body.
Mhm.
Jennifer Perry, have you or other practitioners used electroacupuncture had success with helping and or preventing patients from scheduled ablation surgeries? Acupuncturists are changing endometriosis. They are changing menstrual cycles. They're working with menopause. So whatever treatment you would have done previously to treat that area based on your TCM, your understanding, your diagnosis, what if you could just do it better? What if you could add electrodes to the needles and make that treatment become more powerful and more effective? What if you are putting electroacupuncture on points on the stomach, which are totally filling the uterus? What changes can you make if you have a more powerful treatment? That's the question to ask.
And I would add, you didn't talk about which ablation, if it's a cardiac ablation, for example, certainly you can try electroacupuncture first and see what kind of an effect you have. You may be able to prevent the need for an ablation, for example, if you fill the area with benevolent chi so that it actually has the potential to heal.
Yeah, I went to female ablation, but yes, I get it. Okay, there are two clips, red and green. Which one is used for what? The colors don't matter. What matters, and correct me if I'm wrong, Dr. Adrian, I don't think the colors matter. What matters is on the box that you have turned on, if you have turned on this box to 4.6 or 150, that's what's going to come out of that box. So the two clips are going to both have the same frequency. Did I answer that correctly?
That's correct. The only thing I'd add, and this is basic, so forgive me, everybody who knows this, but both clips have to be connected to the patient or
Yeah.
electricity doesn't go anywhere. It has to go between them. So you can't hook up just one clip and do anything. And if they're hooked together, if they happen to both be on the same needle or something, again, nothing happens. So aside from that common sense, the red and the black don't matter.
But remember that when you're hooking here and over here, if you really believe in acupuncture and what it is and what it does, and you understand those internal pathways, over time, all of that energy is trickling internal within the body, and you're exponentially changing the healing process for the patient. What about mixing treatment of two needle acupuncture and other to I don't think I understand that. I mean, regular acupuncture mixed with yes, I mix regular acupuncture with electroacupuncture all the time. So I am not the four needle technique, only use four needles, heal the patient. I am a hands-on, touchy-feely. I love to use needles. I love to feel what's happening in the body. But if I'm using four needles, let's say I'm using the Ito device and I'm using four needles, I'm choosing four of the needles that I'm doing in my whole treatment to fill the body with benevolent chi. The rest of those needles, I have a philosophy, and I don't have any science to prove it. But my philosophy is those other needles are like signals, like you put an antenna up and saying, come here, come to me, come to me. So if I'm treating CV17 and I'm treating CV12 and CV3, and I'm doing my magical treatment to fill the body with benevolent chi, the CV7, my other needles are still helping the body, but I think they're helping it better. I think that those needles are becoming more effective, and I feel like they're guiding lights, like helping guide that internal energy to go where it needs to go. Is that a true concept, Adrian? Is that a Dr. Kimberly made up concept?
No, that's true enough. I like it. Absolutely.
Okay, partial knee replacement. Um, live with EAM student 3 years. Try electroacupuncture, Mel. You've got what it takes to do this. Isn't there a problem with crossing the midline of the body? Adrian, do you want to jump into that? Because there was a time that's what everyone was afraid of. And so it is a fear that practitioners have, but we cross the midline all the time now.
Yes, and you're typically either, let's say you're doing spinal bracketing, for example, and you're crossing the midline of the spine. That's kind of the point because you want the electricity to enter the spinal nerves. Um, if you are crossing midline, going from an extremity to an extremity, the notion that you're going to either have some sort of a cardiac effect at the low voltages and the low current levels that get used, that really just isn't a fear. Same thing with, going from one side of the head to the other, for example. We are not using strong stimulation. Although we may use high voltage, we're using very low current levels. And so that's very different than the days of yesteryear when you were pumping tons of current into a patient and you had concerns about crossing midline or concerns about crossing the head.
Okay. I know you can use point of select probe to treat the body points as well as the ear, but when treating the body, how do you decide frequencies? So I gave a list of frequencies in my presentation, Frederick. So please print it out and you can read over it. I've given you everything there that you will need. I promise. Are you able to use spinal bracketing if the patient has a spinal cord injury with Harrington rod placement? Is metal? I don't think there's a problem with metal.
Metal is fine. The only issue you have to look for, I mean, you don't want to connect directly to those rods. You don't want to needle right into the rod. And then the only other contraindication is electrical implants. If someone has a pacemaker or something, that's a different story. Metal is not, you're not going to damage or harm the metal in any way. At worst, you're going to conduct electricity along it.
And in my opinion, if so, let's take the second treatment with the point oh select. Well, either of my treatments. If I'm doing GV14 and GV2, and I'm creating this energetic flow through the spine, I am helping to resolve inflammation around that hardware. If I'm just using the point oh select and I'm choosing one point and I'm moving energy up the spine, allowing the energy of the spine to help with the treatment, again, I am just sending energy up the spine and helping to resolve inflammation. And oftentimes that hardware tissue has become inflamed or scar tissue, and you need the benevolent chi in order to help resolve it. Are the point of select electrocurrent digital as effective?
As effective, I assume, as the old school low voltage devices.
They're more effective. So you're getting a stronger, what is the word of the stronger of what you're getting?
You're getting higher voltage, which means you have greater potential to transmit further along the meridians.
That's why when you're going all the way deep into those internal organs, you're getting there faster. And because you're using 4 pathways that each one is getting its full force of energy into it, you're exponentially changing the healing process. Shouldn't the current flow from plus to minus, so shouldn't we put a positive clip upstream and a negative clip downstream?
Want me to answer that one?
Yeah, I remember me talking to you about this. The body is the path of least resistance within the body is where the electrical energy is going to flow. So it's going to flow where the body needs it to go. You may think, oh, I'm only going to allow the energy to go this direction. You don't get to allow the energy. The energy does what it needs to do. That's why you can take a knee and you can treat on two sides of the knee and you're crossing over. That's called differential feed. Even though you're on two different pathways, that energy is going to cross in the middle through the tissue.
And I would add, in straight up old school physics, yes, it flows from red to black. If you're using DC, DC means direct current. Direct is one direction. You're not using that. Any modern device, it is biphasic. It is essentially alternating. It goes back and forth and back and forth. If you only go in one direction, then you're either going to have iontophoresis or you're going to create electrical burns. There's all sorts of reasons not to do that. And that's why DC devices are really frowned on or even not available. So, long story short, no, it goes back and forth, back and forth.
And yeah, it's beautiful. I love it. Okay, Dr. Kim, would you please put the handout in the chat once again? I came on late, coming from work, and would like to have that chart. Have that chart. I didn't have a specific chart handout in
I put the slides in the link to the slides is in the chat right now. Click and download the PDF.
Yep, there you go.
It's right there in the chat. And also, I put a link in to the Point O Select device. That'll take you to the website. Any current specials will be available there. That's where you can find out all kinds of information. The EAI Special Edition is also there. So peruse that, find out what options are available, and let us know how we can help.
Somebody asked, do you see a sympathetic response by electrifying the dew line? So I do not, but I don't just do the dew line. I'm also treating spleen 6 and stomach 36. So I'm creating a parasympathetic response internally in the body while I'm regulating the GV channel. And then if you look at each point on the GV channel and what it does and where it goes and how it affects the internal organs, it's beautiful, right?
And running the do line has a joke in there somewhere about the do run, 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 the do run. Anyway, sorry.
Okay. Daryl says he's not seen anything in the chat. Can you put the link in again?
Yeah, people are posting in the chat.
For the handout.
Yeah, oh, here's why. I apologize. I did put that in there and it went to the panelists. So Kimberly and I can see it, but not anyone else. So forgive me, everybody. My mistake putting that in right now. Thanks for making it known. Boom. There
And
we
because
go.
you signed up for this webinar, you're going to get a recording of this webinar, which will take you to the site. And that's where you will find a link to the download that will live there forever. Oh, you guys, this was fun. I had so much fun preparing this presentation for you. I hope that it created some excitement in you. We have so much work to do these days. Our patients need us. They need us more than ever before. And if you've got better opportunities to help them, I hope that you will grasp it.
Awesome. Well, thanks for all the questions, everybody. 36 questions. That's pretty good. Way to go, Dr. Kimberly. Loved what you did. Loved how well prepared your slides and presentation were. There are a ton of good nuggets in there. So I encourage everybody to watch the replay, do a little bit of studying. You can do this and it will make your treatments more effective. So any parting words, Dr. Kimberly?
If you are an Acugraph user, come and talk to me in the Acugraph user group. If I haven't seen you in a while, I miss you. I'm trying to have some great conversations over there, and come play, share your experience.
Over in Facebook in the Acugraph user group. And if you're not an Acugraph user, you certainly should be. So hit us up.
Oh, absolutely.
All right, everybody. Thank you so much. Really been great. We are going to sign off for now, and we will see you at the next one. Take care, everybody. Bye-bye.